Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
You know, deep inside the incredible complexity of our brain, there's a structure so fundamental that it shapes our every perception, every single sensation, and every interaction we have with the world. Today, we're going to explore the thalamus, what's often called the brain's central gatekeeper. But first, let's start with a question for you. Think about this. Every single thing you see, every sound you hear, every touch you feel, it all has to pass through one critical checkpoint first. So what is it that filters and directs the very fabric of your reality?
Well, the answer is right here. It's the thalamus. This large kind of egg-shaped mass of gray matter, sitting right in the middle between the cerebral hemispheres, acts as the brain's main relay station. It's like a grand central terminal for almost all the sensory information coming in.
Now, to really understand the profound job it does, we first have to appreciate its form. So let's start by taking a closer look at its precise location and its structure. The thalamus isn't just floating around in there by itself. It's actually the biggest part of a region called the diencephalon, which is nestled right in the core of the forebrain. And its position is no accident. It's perfectly placed to be the go-between for the lower brain centers and the high-level processing that happens up in the cerebral cortex.
If we were to look inside the thalamus, you'd see it's not just one uniform block. It's made of gray matter, but that gray matter is intricately divided by a Y-shaped sheet of white matter, which is made of nerve fibers. And we call this the internal medullary lamina.
And what this Y-shaped structure does is pretty neat. It basically partitions the thalamic gray matter into three main regions: an anterior part, a medial part, and a lateral part. This physical division is really the foundation for all of its functional complexity.
Because within these divisions, that's where the real work happens. We find these collections of highly specialized groups of neurons called nuclei. You can think of each nucleus as having a very specific job, with its own set of connections. This makes the thalamus a hub of distinct, yet totally interconnected processing units.
Broadly speaking, we can sort these nuclei into two functional types. First, you've got the non-specific projection nuclei. Think of these as a general broadcast system. They get input from the reticular formation, that's the brain's alertness center, and they can influence the electrical activity of the entire cerebral cortex. But then you have the specialists, the specific projection nuclei. These guys handle very distinct information, a specific touch, a particular sound, and they send that signal to a very targeted, localized area of the cortex.
So let's focus on those specialists for a minute, the ones that build our sensory world. It is right here, in the thalamus, that the raw data coming from our nerves becomes the gateway to our sense of touch, hearing, and sight. Each sense has its own dedicated pathway. For instance, sensations coming from your body travel to the ventral posterolateral nucleus. We'll just call it the VPL. Sensations from your face, they're routed to the ventral posteromedial nucleus, or VPM. Visual information is handled by the lateral geniculate body, the LGB. And everything you hear comes through the medial geniculate body, the MGB. Each one of these meticulously processes its own specific data before relaying it on to exactly the right spot in the cortex. But the thalamus isn't just taking in sensory data. It's also a crucial player in coordinating movement. The ventral anterior and ventral lateral nuclei are critical relay stations that refine motor signals coming from the cerebellum and basal ganglia before sending them up to the motor cortex. This is what allows for smooth, coordinated action. And all of this reveals a really crucial point. The thalamus is so much more than a simple relay. Its role extends into the very processes that make us who we are, our consciousness, our emotions, and our thoughts. This really builds a much more complete picture of just how important it is.
I mean, just look at its portfolio of functions. It's the primary sensory relay center for sure. Everything except smell goes through it, but it also gives us our first crude awareness of things like pain and temperature. It integrates motor function, it keeps us awake and alert, and it helps color our experiences with emotion. It's even involved in language, helping to connect different parts of the cortex so we can understand and speak.
So, given this incredibly central role, you have to ask, what happens when this intricate system gets damaged? Well, the consequences can be profound and can lead to a condition that we call thalamic syndrome.
Thalamic syndrome is a truly devastating disturbance of sensory experience. It's most often caused by a stroke, specifically a blockage of a tiny artery that supplies blood to the posteral ventral nucleus. That's the very region that processes sensations from the body. So when that specific hub is damaged, the brain's ability to interpret sensory information is just thrown into chaos.
The symptoms really reveal just how critical the thalamus is. Patients often have sensory loss on the side of their body opposite to the damage. They might develop something called a thalamic phantom limb, where they literally can't tell where their own arm or leg is without looking at it. But maybe the most severe symptom is what's known as thalamic overreaction, where normal sensations are completely transformed. What happens is a dramatic shift in how sensation is experienced. The threshold for feeling anything just plummets. A gentle touch, a slight change in room temperature, things that would normally go unnoticed can suddenly become intensely exaggerated, deeply unpleasant, and even agonizingly painful. It's a stark reminder of the thalamus's role in fine-tuning and giving context to everything we feel.
And this brings us to a final, pretty profound thought. The thalamus isn't just a relay. It's an active filter, it's an editor, it's the conductor of the whole symphony of information that becomes our conscious experience. And that really begs the question. If this tiny central hub so fundamentally shapes our perception, how much of what we call reality is actually a construct of its intricate and very fragile design?